If someone is colonized with Candida auris, it means that person has the yeast somewhere on their body, for example, in the urine, the nares, or on the skin, but does not have an infection or symptoms of an infection. The yeast can spread from persons who are either colonized or infected. Therefore, healthcare personnel need to implement infection prevention and control measures correctly and consistently to reduce the risk of transmission on the unit or floor. Currently, there is no specific intervention known to decolonize patients who are colonized with Candida auris. Topical antifungals and chlorhexidine have not yet been proven effective for decolonization. In fact, transmission has been observed in facilities routinely using chlorhexidine bathing. So once a patient is found to be colonized with Candida auris, repeat testing for colonization is not recommended. Results may vary intermittently based on their health status. For example, if a colonized person is sick or on antibiotics, their flora may change, and they may test positive for Candida auris colonization. Whereas when fully healthy, their body might have low levels of Candida auris, and they would test negative. An infection happens when Candida auris enters the body and causes a patient to have symptoms. It can cause infections in different parts of the body, such as in the bloodstream and in open wounds. The symptoms depend on the location and severity of Candida auris infection. Symptoms may be similar to those of an infection caused by bacteria. There is not a typical set of symptoms specific to Candida auris infections. However, fever and chills that don't improve after antibiotic treatment can indicate an invasive fungal infection. Patients who are colonized with Candida auris, especially those with high acuity and invasive devices like lines or tubes, are at risk of developing invasive infections. Invasive infections can develop at any point after patients become colonized. This is especially worrisome for patients in hospitals and nursing home residents with serious medical problems. More than 1 in 3 patients with invasive Candida auris infection die. Healthcare personnel can help prevent infections by diligently following infection prevention and control practices. Regardless of whether a person is colonized or infected with Candida auris, they should be managed using the same infection prevention and control measures, as the organism can spread either way. In short, the primary infection prevention and control measures include strict adherence to hand hygiene at all key moments in healthcare settings. Remember, alcohol-based hand sanitizer with at least 60% alcohol is effective against Candida auris. Appropriate use of standard and transmission-based precautions based on the healthcare setting. Cleaning and disinfecting the patient care environment and reusable equipment with an EPA-registered List P disinfectant. Communication and coordination about the patient or resident's Candida auris status. This is critical during transfer to another unit or healthcare facility. Thank you for listening today. This video is part of a 10-part video series on Candida auris. To access additional videos, please visit the Candida auris video webpage at health.pa.gov/c-auris-video. For questions about Candida auris, please contact your local health department or call 1-877-PA-HEALTH.